Now, doctor, in the past, it had been recommended that women, or suggested that women for breast cancer start having their mammograms at around age 50, and correct me if not. But what I have found, and I've met several women that have been stricken or diagnosed with breast cancer, no family history or nothing, but at an early age. So, what would contribute to that as far as them being diagnosed at such early ages of breast cancer?
Well, actually, to address your first issue first, we recommend the American College of OBGYN as who guides the American Gynecologist Obstetrician, and they actually are recommending your first screening mammogram at 40. Now, a year and a half ago, the government came out with a task force who said age 50. But the American College of OBGYN and Cancer Societies are still recommending age 40 and offering it every year or two after that. So we still say 40, and I agree with that decision because, as you said, we are seeing some younger women. There are some genetic factors that do contribute. However, as you said, most people do not have a family history that we diagnose breast cancer. So other things that would work together as factors would be early periods, onset of early periods, no children by the age of 30. Obesity is also a risk, estrogen exposure, and sometimes we just don't know why. So we like to start that screening early.
Doctor, do you find that in some cases there are certain diets that play a key factor in the I don't know why?
High-fat diets, yes.
Yes. Okay. Also, there are discussion about, and I'm finding there are so many women who just say, I'm too busy to go in for annual exams and mammograms. Oh, I don't have time for myself. But as we talked about earlier in the show, it's important to take time out to take care of ourselves, especially our health, because what I always say that if we don't take time and put ourselves first, and then if we're sick and down, who's going to really take care of us? Because I've seen in so many cases women are just, I'm corporate executive, I'm busy, I'm going here, going there, and I have met women who are in their 50s who have not had pap smears or mammograms or whatever. So what is your recommendation and advice to these jet-setting, high-powered women, and they're not, you know, the one who just feel that, oh, that's not going to happen to me? What is your recommendation and advice to these women?
I think that's an excellent point that you bring up.
you.
That's very true. I would say get in there, get that screening, because early detection and prevention are exceedingly important. If you catch it before it actually turns into cancer, it's pretty easily treated. The earlier the detection, the easier the treatment, and the better the success rate on the treatment, and the longer your life, and the better your life quality is. So you are, good point.
That is excellent. And so as we move forward in this fast-paced, stressful world and our lifestyles, and I'm just finding that each and every day begins to get faster, and we're racing to do this and get there. But most of all, and most importantly, is we must take time out for ourselves, put our health and our skin care and the things that are going to take us to a long, productive, aging, older life. So take the time out for yourself, pamper yourself, maintain that proper skin care. Make sure you go in and get those regular exams. And this applies to women and men, because there are some men that get breast cancer. Is that correct, doctor?
Yes, there are. There actually are a lot fewer percentage-wise than women. But if you do have a male relative with breast cancer, that is a red flag that there might be a genetic condition that your family has. And if your family does have that gene, then you have a very high percentage of developing breast or ovarian cancer down the road, and there are a lot of preventative steps we can take, and we watch you a little differently. So that is a very important point.
And doctor, for those women who've never had a mammogram or a pap smear and feel that, oh, I don't want to go through that, can you just briefly explain to them what those procedures entail to give them a little more comfort in getting in there to be screened and tested for those?
Sure. A pap smear is what prevents cervical cancer, and if you do it in a timely fashion, you will not get cancer, and it can be very easily treated before it ever even gets close to cancer. It's not painful at all. We just put a little spatula on the cervix or the mouth of the womb and take a sample of those cells, and they go to the laboratory and look for cells that are actually precancerous. It's not at all painful, and it's most people do just wonderfully. The mammogram is we take the breast tissue and put it between two plates of film and sort of x-ray it, if you will. A little bit uncomfortable, but certainly well worth it. We pick up some very early precancers and cancers which are easily treated, whereas if you let it go a long time or wait till you can see or feel a lump, then it's going to be a lot of therapy and not quite as good of a cure rate.
Wonderful. So I'm going to encourage all of you to get in to see Dr. Somerset. Call in to the East Side Gynecology and Obstetric Center and book that appointment. She will tell you, I'll give her a few more minutes to tell you where she's located. They have various locations and how you can get to her. Write her number down, call her, get in to see her right away. Doctor, I'm going to let you tell them what your phone number is and the locations that they can find you at so that they could get in to see you right away.
All right, well, we have, actually we have 10 physicians and 2 midwives in our practice, so it's pretty easy to get in with somebody, and you can pick the sex of your choice and the age of the physician you'd like. And we have 3 locations, as Kim mentioned earlier. One is in the Macomb area, one is in Grosse Pointe, and one is in Roseville, and our phone number is 586-415-6200. All you have to do is call. It's very easy to make an appointment, and you can get in a very timely fashion as well.
Wonderful. So don't wait. Do not put it off. Please go ahead and get in. Both the GYN Center and the Eastside Skin Care and Laser Center. We're looking to see you there. And I would like to thank the sponsor of the show, which is the Eastside Skin Care and Laser Center, who is now part of my family. And we will plan to have the doctor and Kim and Jane back to visit us again to talk more about the skin care treatments and their facility. And we hope to see you back with us next week for a wonderful and exciting show. Have a blessed week. Thank you.